Hepatitis means inflammation of the liver, and according to the Centers for Disease Control and Prevention, about 300 million people are infected with hepatitis C. Dr. Homan Zadeh from Desert Regional Medical Center discusses some of the symptoms and risks of hepatitis C.
Symptoms of hepatitis C are quite silent. In the initial infection, you really don't have any symptoms or signs. Some people may get sick with fatigue. Some people rarely may get jaundice, but that's typically not the case. You see that more with hepatitis A and B. Hepatitis C, the natural course of the disease itself, it takes about 40 years or so to cause problems. And the problems with hepatitis C are, number one, cirrhosis, and number two, hepatocellular carcinoma or liver cancer. Hepatitis C is diagnosed by a blood test. There are two general tests that we do. One is a hepatitis C antibody test. And typically, if you've been exposed to hepatitis C, your antibody will be positive. The follow-up test to that is a hepatitis C PCR test, where it actually measures the viral count.
Who is most at risk for hepatitis C?
Hepatitis C is a blood-borne type of infection, similar to hepatitis B, similar to HIV. Risk factors include exposure to infected blood, which could include use of IV drugs, use of dirty needles, sharing dirty needles, tattoos with dirty needles, blood transfusion prior to 1991, piercings, again with dirty instruments. Some even suggest vaccinations in outside countries with dirty needles, if that was the case. That comprises about 90%, I would say, of the risk factors.
Dr. Zadeh tells us how hepatitis C is treated.
We started treating hepatitis C in 1991 with a medication called interferon, which is an injection. Towards late 90s, another medication, or oral medication called ribavirin was added. And by using the combination of interferon and ribavirin, we got a good 5, 10, 15% bump in our cure rates. This year, another second generation set of antivirals has come up, where we could treat hepatitis C now between 90 to 100% at a time, chance of cure. Another point about hepatitis C is it's divided into 6 different subtypes. Type 1, 2, 3, 4, 5, and 6. In the US, the most common type is type 1. About 75% of the population has type 1. And that's the most difficult type to treat. With the current therapy that we have, we could treat hepatitis C, even type 1 genotype, about 90% of the time. The other types, 2 and 3, are easily treated even without interferon, with 2 oral medications, close to 100%. And type 4 is also another type which we see, not as common as type 1. That's a little bit more difficult to treat also, but we could easily push into 90-95%.
Dr. Zadeh, what does the future hold for hepatitis C patients?
Future is bright in terms of treatment for hepatitis C. I'm sure education about risk factors has played a role, but I think the aggressiveness of the medications that we have nowadays. I mean, if you think about it, you identify an entity in 1991, and in 2014, 2015, you could virtually say that I'm able to cure this disease. That's a great leap for science. And it's really a joyful experience to be part of this, to see the progression and evolution of the treatment of this disease itself.